And we're going to come to Rachel. Rachel, good afternoon. Hello.
Hello.
Thank you so much for joining. Thank you for entering. Of all the entries, Rachel, I think you might win the prize for the most personal connection to the questions you put forward. Do you want to talk a bit about your personal professional background and what you were thinking in terms of the questions?
Okay, thanks. And thanks for inviting me today. I saw the information about this competition on a chat at work, and my colleague Ollie had posted, and he said, it'd be a really good idea if people applied. And I kind of thought, yes, I will, and I'll do it now, because if I don't do it now, I won't get around to it, I'll forget about it. So I work for NHS England. I'm a project manager. I work as part of the Experience and Partnerships team. So the role that I do in my day job is very much about involving patients, members of the public, people with lived experience, trying to improve policies and provision based on people's needs. But I'm also a carer for my mum. I was a carer for both my parents, but sadly my dad died in June. My mum had a stroke 6 years ago, so she's quite disabled as a result of that. And she has carers coming in 4 times a day to help her with personal care, but I'm her carer, so I do everything else. And I just thought, well, what would I want? If the person I'm dealing with is like, let's pretend it was my mum or my dad, what would I want to do for them? Because as far as my experience is, and I think I speak for a lot of carers, is you want the very best for the people that you love, and there's nothing that you won't do for them. And it does also bring an anxiety as a carer. You worry that sometimes there's other things you should be doing and you just don't know what they are. So yes, it is very personal, and so my questions reflect that, but also I wanted them to be quite simple. So I didn't want them to be unnecessarily complicated. So that's why I thought, well, if I try and focus on what would I want for my parents, then that would be something that maybe can resonate with a lot of other people. And then looking at what do you want? That's the second question. Is we've all been in situations, haven't we, where we can think, well, how were we made to feel? What was the care like we received, and how did that make us feel? So I think that's another way of just maybe looking at the first question slightly differently. And then the final question, this is a coaching tool, part of something called the GROW model. So when you're coaching somebody and you're trying to support them with an issue or a problem, you would say to them, after they've described what they're going to do, and what else would you do? So it's just thinking about what else, because we've talked about working together in partnership and how important that is. So it was about looking at the synergy that working with other organisations and other people might bring. And it's not necessarily around health or care even, but it's maybe around social prescribing or other organisations or friends or family. So very much looking at the person in a holistic way and providing the very best for them.
Rachel, thank you so much, and thank you, just to echo the thoughts in the chat, thank you so much for sharing this with us. You make this point, Rachel, about you say simplicity, but there's so much actual complex stuff going on under the surface. Why do you think we sort of lose touch with some of what you talk about here? There's so much which goes on in interviews about this competency or that competency, but there's something so wonderfully grounding about your questions. Well, why do you think we move away from things which are just so important?
I think it's such a huge field, such a wide arena with lots of different specialisms, that it can be easy sometimes to focus on the specialism. And what we want to do is bring that back to focus on the person. And I give talks in schools for an organisation called Inspiring the Future. So I go and talk to primary and secondary school pupils about what's it like working in the NHS and the fact that there's more than 350 different job roles. And that's not including social care. So including social care as well, it's even bigger than that. And I just think because of the vastness health and social care. That's maybe why sometimes we can not focus on the very simplistic but really important at the heart of the issue, the person.
Rachel, lovely. Thank you so much. I'm probably not the only one on this call wishing that I could go to a school where you're going to give a talk. Rachel, thank you. We'll give you a round of applause. Rachel, thank you so much for sharing. Thank you so much for entering and joining with us today.